We are back with Kelsey O'Harris. She is a certified nurse midwife at Sanford Health, and we are talking about kind of the ups and downs of weight in women and men as well. So.
I thought it was great. You just mentioned that this is a really good reason to have a doctor, a provider who you see on a regular basis. You can have that relationship with. So I feel like then you don't have to be scared about asking some of these questions. Why is that so important? And can you see the difference in your patients?
Absolutely. So as a midwife, we try to develop really therapeutic, trusting relationships with our patients. We spend the time to get to know them, really know them holistically, and talk about all of those different things that we talked about before the break that can affect weight loss. And I didn't mention the things that are kind of out of our control, because we can somewhat control our sleep, our stress, our diet, our exercise. But there are things like genetics. Are our families more predisposed to gaining weight easier? Things like socioeconomic status. Do you have ready access to nutrient-rich foods? Do you feel safe in your neighborhood exercising or doing activity outside? So all of it is very complex and hard to do by yourself. So having a professional, whether it's a doctor, a midwife, a nurse practitioner, a physician assistant, who can help navigate those waters with you is really important.
Yeah, very good points. Absolutely.
And I feel like age, we already talked about this a little bit, from like 20, but even from like 40, 50, 60, does metabolism really slow down at that point? And are men and women different? Because I joke, but there's truth to it. My husband stops drinking pop for like a week and he loses like 10 pounds. And like I don't ever drink pop, and I gain weight thinking about him losing weight. It's just
right.
And he says you're making this up, but I don't think so. There's a big difference between men and women, right?
It is
absolutely. And like you said, as we get older too, our metabolism slows down. I'm not sure if Bailey mentioned it yesterday in the menopause conversation, but after menopause, we see our metabolism take a big hit. And a lot of it is because our bodies aren't needing to do the work of like shedding the uterine lining every month to make room for a baby, so that's less work. So our metabolism slows down because of that over time, which is I find kind of interesting.
That is, I've never heard.
I know,
never heard that. I was like, no. So yeah, you just hear it slows down with menopause, but why? Okay,
so what do you
have
to do to? I mean, what should we do, or what can we do to increase that metabolism again?
Absolutely. So. It's important to be active, and having more muscle mass can help your metabolism a little bit, because muscle is going to burn calories a little more efficiently than any other tissue. So doing like strength or resistance training, it doesn't have to be really anything hardcore. If you have resistance bands, those are a pretty cost-effective way, or just doing body weight exercises like push-ups, lunges, crunches, planks. Or if you have a gym membership, going to the gym and focusing not only on cardio, which is important for your cardiovascular health, but building up that muscle mass as well. And as a little bonus, you get some good bone density with that too.
Oh, good point there too. I love it.
There's no magic pill, but are there any medications that can help the process though? I mean, I feel like 10, 20 years, we're hearing a lot of pills on the market that would help, but I'm not hearing much anymore.
Yeah, there are none that you really see like as a fad or in commercials or things. There are some, but they're not the things that I like to do first. I like to talk to my women about their diet. Are they eating foods that make their bodies feel good? So lean proteins, vegetables, fruits, whole grains. Are they moving in a way that makes their body feel good, at least usually about 30 minutes 5 times a week? Are they getting good sleep? Is their stress under control? Trying to do all of those things before moving to the medication realm.
And also, we talk about when to eat or when not to eat, and there's fasting going on. A lot of people are doing that, and so. But what are kind of the stay true tips to when to eat, when not to eat, and what not to eat, right before you go to bed?
Yes, that's a really good point. Our body needs a little bit of time to break those things down, to metabolize food right before bed. I think it's really important to find an eating pattern that works for you and works for your family as well. If it works to have the 3 meals, we can talk about that. If it works better to have 4 to 6 small meals a day just to keep that blood sugar really stable throughout the day. That's what I like to recommend to a lot of my pregnant mamas, is kind of snacking little meals, 4 to 6 small meals a day, can help too. So just eating in a way that makes your body feel good is what I like to focus on.
Okay. And start that conversation. Can we go back to that?
Absolutely.
Don't be scared to just ask.
Yeah, it's really vulnerable to bring up a thing like weight with all of the pressure that we're getting from all sides, but we're always happy to talk about it, and we want to help you guys succeed.
Okay.
Awesome.
It's a great conversation.
you
So
so
many
much.
things
Thank
go
you for
into
having
it.
me.
I know.
And,
I know. And we
we're
just
all
have
in
to
the same
stay
boat.
on top of. You just have to stay on top of things
Yep.
with yourself and stay. I mean, like you said, stay active.
Absolutely.
Staying active is important. So thank you so much.
Thank you for having me.
Yes. Coming up on today's show, how your old shoes can help out a good cause.